So let me take this opportunity to speak about ovarian cancer. Hello everyone, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist here at Apollo Hospital, Manerghatta Road in Bangalore. Ovarian cancer is not a very common cancer, but it is an important cancer. It is important because very often it overlaps with ovarian cysts, which are a common findings in females. So very often we have patients who have an ovarian cyst and are worried that they may have cancer. That is one aspect. And the second aspect is, though it is not a common cancer, it certainly is an aggressive type of cancer and can be lethal in certain number of patients. So what are the symptoms of ovarian cancer? Now, ovarian cancer can be quite silent. This is because ovaries, especially in postmenopausal women, don't have any sort of function. So we can have ovarian cancer with absolutely no symptom at all. In certain other females, they just go with bloating or abdominal distension. Many times they would have just mistaken this to obesity or weight gain, and on evaluation, they are found to have ovarian cancer. Certain other patients directly present with symptoms of metastasis, that is fluid accumulation in the chest leading to breathing difficulty and spread to other organs. Since ovary is closely associated with both bladder and the rectum, many patients come with urinary symptoms like increased frequency of passing urine or bowel symptoms like difficulty in passing stools. Like I said before, ovarian cysts are a common occurrence. I would also like to take you through which cysts are more dangerous compared to which cysts are less this one. So, very often we get ladies who come to us with ultrasound reports. They are absolutely asymptomatic, and when an ultrasound is done, there is mention of an ovarian cyst. More than 90% of the times, these cysts are harmless. There are many other reasons for these cysts to develop. Cysts can be just due to the normal process of ovulation. Like in certain cases, we get what we call corpus luteal cysts or follicular cysts. In certain cases, it can be due to a condition known as endometriosis, which presents as cysts in the ovary. And some ladies have hormonal disturbances due to a condition known as polycystic ovarian syndrome. And very often, ovarian cysts can be benign, what we call cystadenomas. So most of the time, it is one of these. But we also have to remember that a certain number of cysts can be malignant. So as clinicians, how do we differentiate the more dangerous ones, which are the wolves in sheep's clothing? So normally we get an ultrasound done, and to a certain extent the radiologist will be able to give us a clue. Certain things like presence of solid elements within the cyst, presence of increased vascularity, presence of free fluid in the abdomen or intra-abdominal lymph nodes, or metastasis outside the ovary, all this will raise the suspicion towards ovarian cancer. So if the ultrasound, which is a preliminary investigation, mentions of these things apart from the ovarian cyst, we are more worried that this could be ovarian cancer. Apart from this, we also do a blood test known as CA-125. This is a very important test for us. If the CA-125 is very high, then there is a higher possibility that the ovarian cyst can be malignant. A high CA-125 alone does not diagnose malignancy. CA-125 can be high in many other conditions like endometriosis. But it should certainly raise or ring bells that this cyst can be malignant. Thank you.